Now we'll move on to a different genus of gram-positive cocci, the Streptococcus genus. Unlike the staph genus, which form clusters, streptococci grow along a single axis and form long chains or pairs. The first group of Streptococcus that we'll cover is Strep pyogenes, also known as Group A Strep. So watch as we transform pyogenes into a scene we'll call the Pyogenes Bakery. Let's get started. We've got a lot to cram into this video, so the backdrop will be pretty simple, and I'll also try to keep my explanations as brief as possible. The Pyogenes specialize in making pies, so let's start by drawing a pie. And we'll cover it in a nice glass capsule that bakers would use when it's on display. This glass capsule looking dome is going to represent that Group A Strep is encapsulated. You'll notice we specified that this is hot apple pie. The H and A in hot and apple actually stand for hyaluronic acid. Strep pyogenes capsule is made out of hyaluronic acid. And we also actually produce hyaluronic acid in our connective tissue. And this is good to know because if we already have hyaluronic acid everywhere in our body, this means that the pyogenes capsule cannot be immunogenic, or else our own immune system would constantly be attacking us. Now we're drawing a heating lamp over the pie. Notice anything special about the bulb? Yep, that B in the bulb's filaments means that it's our beta hemolytic light bulb. So Group A Strep is beta hemolytic. Let's dive into some clinical features of pyogenes and discuss the pyogenic infections that it can cause. They'll all be represented by our first pyogeny baker holding this pie. And there are three main ones that we're going to talk about. The first is impetigo, a pyogenic skin infection that is said to look honey-crusted. This is represented by our honey-crusted lemon pie. But remember, impetigo can also be caused by Staph aureus. So if somebody has impetigo, it doesn't necessarily mean they have a Group A Strep infection. The second pyogenic infection we'll talk about is pharyngitis, or more commonly known as strep throat. We'll represent this by drawing on a red handkerchief. So when you see it, think of a really, really red, erythematous, and inflamed throat. Again, that's for pharyngitis. The third condition is really two conditions, cellulitis and erysipelas, but they're very similar. All erysipelas is basically a very superficial cellulitis infection with well-demarcated borders. Strep pyogenes is the most common cause of erysipelas, so we'll represent these two by drawing big red mittens on this baker, which indicates erythema of his skin. So we've just covered three pyrogenic infections. Now we're going to move on to infections caused by the strep pyogenes toxin. The toxin is referred to as streptococcal pyrogenic exotoxin, or SPE. The first condition is scarlet fever, and there are three main symptoms of scarlet fever that we want you to know. The first is reddening and swelling of the tongue, and this is referred to as a strawberry tongue. We'll represent this by having the cook sticking out his tongue to lick the strawberry. And the second symptom of scarlet fever is pharyngitis. We'll represent this the same way we represented pharyngitis earlier, with a red handkerchief around his neck. And the third and final symptom is a widespread rash that spares the face. We'll represent this by having the chef smearing the gingerbread with red frosting that covers everywhere except the face. Another condition caused by this toxin is very similar to Staph aureus' toxic shock syndrome, and it's referred to as toxic shock-like syndrome, or TSLS. This toxin behaves as a superantigen just as it does for Staph aureus, so we'll use the same cape, the super cape with the lightning bolt, where super stands for superantigen and the lightning bolt for shock. Now there are three toxigenic syndromes caused by the exotoxin. We've covered two, scarlet fever and toxic shock-like syndrome. So the last one is a very scary one. It's been referred to in the press as the flesh-eating bacteria, and this is necrotizing fasciitis, which can be caused by the toxigenic strains of strep pyogenes. It invades the fascia underlying the skin and spreads very rapidly, so it's a true surgical emergency. We'll represent this by having a burnt gingerbread man with his leg falling off. The burn looks like necrotic tissue, and the leg is missing because it is sometimes necessary to amputate the affected region. So in a very organized manner, we've covered all of the toxigenic conditions caused by pyogenes in this corner with the gingerbread baker. Again, there are scarlet fever, toxic shock-like syndrome, and neck fash. And as I mentioned earlier, all of these are caused by strep pyrogenic exotoxin, or SPE. However, There are 3 separate types of SPEs, and those are A, B, and C, and I don't believe they're extremely high yield, but you may want to know them. SPE-A and SPE-C are superantigen toxins that cause scarlet fever and TSLS. The SPE-B is a protease that causes neck fash. To make this easy, all you need to remember is that the B causes neck fash, and by elimination, A and C cause the other 2 syndromes. So you can apply this to our story by remembering that our gingerbread man representing neck fash is burnt, which starts with B. So we'll write this B on the neck fash gingerbread man, and that should be good enough. We'll move on to cover 2 highly tested conditions pertaining to strep pyogenes, and probably the most important things in this video. These are rheumatic fever and post-streptococcal glomerular nephritis, or PSGN. Since these are very serious complications of infections with group A strep, the boards may try to get you to confuse the 2. We'll do our best to make sure there's no confusion so that you get all of these questions correct. First, we'll cover rheumatic fever. Since this is arguably the most important topic that we'll cover, we're going to make this character a little different, a little special. He'll be the master chef. So we'll go ahead and write an M on his hat. In this story, M stands for master chef, but for us, M actually has another meaning. It stands for M protein. M protein is a highly antigenic protein in the group A strep cell wall, and it's the main virulence factor responsible for rheumatic fever. And there are 2 ways it really acts as a virulence factor. First, it interferes with opsonization, thus it is antiphagocytic. We'll demonstrate this by having this other chef reaching behind him and trying to steal and eat one of these cupcakes, while the master chef swats him away, thus preventing him from eating or having an antiphagocytic action. And the other aspect of M protein's virulence is that it's very antigenic and elicits a very strong humoral response. Because of this strong response, there's a great chance that we'll create antibodies to a very similar self-antigen, which is the myosin in our cardiac muscle. And this whole process is called molecular mimicry. And again, just because this is really important, the M protein mimics the myosin in our heart and causes our own antibodies to attack our heart. And when this happens, it causes really big problems, especially for our heart valves. You'll notice that this hat is a little bit different from the other hats. Well, we've chosen this hat for a very specific reason. This type of hat is called a mitre hat, or it's a hat that the Pope wears. And actually, mitral valves were given their names because when they open, their 2 flaps kind of look like these mitre hats. So anyway, we've given him this mitre hat to remind you of the mitral valves, which are the valves most commonly affected by rheumatic fever, specifically causing a mitral stenosis. Rheumatic fever starts after strep pharyngitis infections, but it does not happen after skin infections. It also doesn't happen if pharyngitis is promptly treated, which is why you see it more commonly in young children who have little access to health care. We'll draw the red handkerchief once more to show that pharyngitis precipitates RF. Now, the symptoms of rheumatic fever are categorized into 5 major criteria called the Jones criteria, and each letter of Jones stands for one of the criterion. So this is a really nice mnemonic already, so we'll use it, but we're going to elaborate it and make it even more obvious, because that's what we do at Sketchy Micro. The first letter, J, stands for joints. It causes polyarthritis, which is actually why I was given the name rheumatic fever in the first place. We'll draw the baker standing next to him, having accidentally just bumped this J cupcake with his elbow. Notice the frosting on his elbow? This just reinforces joints. Then there's O, which isn't actually an O. It's meant to be the shape of a heart. So we've drawn a nice heart shape here, and this signifies that it causes heart problems. The heart problems are valvular damage leading to new murmurs, myocarditis, and pericarditis. Next we have N. N stands for nodules, specifically subcutaneous nodules that most commonly appear on extensor surfaces of forearms or on elbows and knees. We'll draw these nodules looking like candies sitting on top of the cupcake. E stands for erythema marginatum, a rash with really nice thick red borders. We did our best to illustrate what it looks like on top of this cupcake, but it was a small canvas, so I recommend that you Google it if you're interested in seeing more accurate representations. Finally, we have S, which stands for Sydenham's chorea, which are rapid, involuntary movements, especially of the hands and face. And that's really it for rheumatic fever. And we'll move on to the other very highly tested condition, post-strep glomerulonephritis. And I think this is very highly tested, mostly because it has a very strong tie-in to pathology. Like rheumatic fever, the damage is caused by our own immune system after a strep infection. However, unlike RF, the damage isn't a type 2 hypersensitivity reaction, it's a type 3, which means that the damage is from circulating antibody-antigen immune complexes that eventually deposit in the glomerulus. To represent glomerular damage, we'll draw this chef talking on the telephone, and you'll notice that its cord has been twisted here into a little ball, and it looks a lot like a glomerulus. The two main symptoms that you'll see for PSGN are dark brown or cola-colored urine, and facial swelling or puffiness from edema. Since this chef is eating, we'll make his cheeks especially puffy to represent the facial puffiness, and we'll draw a bottle of cola down by his feet to remind you of cola-colored urine. You'll need to remember that PSGN occurs 2 weeks after the onset of the initial strep infection. We've illustrated 2 weeks in this calendar here by circling in red a date that is 2 weeks from today. I'm going to cover two major differences between rheumatic fever and PSGN that are commonly tested by examiners and somewhat tricky, but I think we do a really good job of sorting that all out. The first is that RF only occurs after pharyngitis, whereas PSGN can occur after either pharyngitis or a superficial infection like impetigo. To show this, we of course have our pharyngitis handkerchiefs on both of these chefs, but we'll only have the honey-crusted crumbs of impetigo on the chef's face that represents PSGN. The second major point of confusion has to do with treatment and complication prevention. Early diagnosis and treatment of strep throat can prevent RF, but it will not prevent post-strep glomerular nephritis. The treatment for strep infections is penicillin, so we'll have our chef with post-strep glomerular nephritis holding a pencil, which represents penicillin. And the way I want you to think about this, so that there is no confusion, is to say to yourself, even though this chef has penicillin, the pencil, he still has symptoms of PSGN, denoted by the puffy face and cola-colored urine. That should keep things straight for you. We've still got 3 more virulence factors for strep that we want to cover. Sorry, I know this is a lot. It's kind of a marathon session. You can blame the microbiologists. It's their fault for discovering all of this info. But I'll try to be fast. We'll illustrate all 3 of them surrounding this beaker over here on the bottom right. First is streptolysin O, which is the virulence factor that allows group A strep to lyse red blood cells and be beta hemolytic. We'll represent streptolysin O with some O-shaped donuts that are jelly-filled and leaking as if they were just lysed. It's important to know this virulence factor because we generate antibodies to streptolysin O, called ASO antibodies, and I'll get back to those in a second. Next virulence factor is streptokinase. Kinase means simply to put a phosphate on something. So we have little muffins with phosphates attached to them. Streptokinase is important to know because it converts plasminogen to plasmin. Plasmin is fibrinolytic. So streptokinase is actually given as a medication to lyse clots during, say, MIs or ischemic strokes. Finally, we have our twists. These are twisted in double helixes like DNA. This is because they represent DNAases, or dornases, which depolymerize DNA, and really this is the least important one to know. In fact, I'm even starting to wonder if we just included it so that we could show off our creativity with baked goods. Okay, now on to something that's actually important to remember. This is a basset hound. He's going to teach us how we differentiate group A strep from group B strep. Group A strep is bacitracin sensitive, whereas group B strep is bacitracin resistant. You see that our basset hound, or bacitracin hound, is able to get up on the counter and munch on our DNA twists? Well, this means that they're sensitive to the basset hound. So strep pyogenes is bacitracin sensitive. You'll see in our next video that group B strep is bacitracin resistant. So I promise we only have one more thing left, and it'll be super quick. Let's draw this lady, and she's checking a box of donuts that she just purchased. Notice she's using similar tongs to this baker over here on the right. Well, these tongs are supposed to look like antibodies. She just purchased a box of our ASO donuts, and she's checking their amount, or their titers, with ASO antibodies. These ASO titers can tell us if we've recently had a group A strep infection, which is particularly helpful when trying to diagnose acute rheumatic fever or post-strep glomerular nephritis. Okay, now we're going to talk about the 10 different chemicals in the wall of strep pyogenes. I'm just kidding, we're done. On to the next one.